an 80% failed heart, an ejection fraction of 20% or less. Most people hear these numbers and think it's a death sentence. But here's the truth. Survival is absolutely possible. In fact, with the right treatment at the right time, many patients with severe heart failure go on to live years, even decades of meaningful life. Today, I'll show you exactly how. This video is for educational purposes only. If you or a loved one have these symptoms, seek emergency medical care immediately. First, let's be honest about the numbers. Without advanced treatment, stage D heart failure, which is what 20% EF means, has a median survival of less than 2 years. With advanced therapies, like LVADs and heart transplants, survival improves dramatically. 1 year survival on medical therapy alone is less than 20%. Over 80%. Left ventricular assist device is a mechanical pump that's surgically implanted in your chest. It helps your heart pump blood to the rest of your body when your heart is too weak to do it alone. The numbers are impressive. Modern LVADs like the HeartMate 3 show 2-year survival rates of approximately 84%, and that's including patients as old as 80. But it's not just about survival, it's about quality of life. More than 80% of LVAD recipients improve from severes to mild or no symptoms within 3 months of implantation. So how does an LVAD compare to a heart transplant? Studies show 3-year survival is 83.7% versus 87% with transplant, meaning LVADs are now approaching transplant-level outcomes. Here's a surprising twist. When you factor in the time spent waiting for a transplant, an LVAD may actually provide better survival. Many patients die waiting for a donor heart, but an LVAD buys you time. A heart transplant is still the gold standard, the best long-term option. For eligible patients, it offers the most freedom from heart failure symptoms. Life expectancy after transplant is more than 12 years. Survival after transplant is excellent. At 1 year, it's about 92% nationally. It's around 85%. At leading centers like Cleveland Clinic, 1-year survival is 97.6%. Now, what about medications alone? At 20% EF, some patients, especially those who respond well, patients achieving low filling pressures had 83% 1-year survival. But here's the key. Not everyone is a candidate. Patients considered for advanced therapies typically have persistent NYHA Class 3 symptoms, despite optimal medical therapy and recurrent hospitalizations. Doctors use the I need help criteria to identify who needs advanced therapy. It stands for IV inotropes, edema, low BP, and prognostic medication intolerance. Timing is everything. If you wait too long, permanent organ damage can make you ineligible for advanced therapies. That's why early referral is critical. For patients not ready for surgery, this includes ACE inhibitors and SGLT2 inhibitors. In the new era of quadruple therapy, reversal from stage D to stage C is possible. SGLT2 inhibitors, like empagliflozin, are reduce heart failure hospitalizations by about 20% with advanced disease, and they're well tolerated even in patients with kidney disease. Unfortunately, not everyone is a candidate. Patients with severe irreversible organ disease may not benefit from ELV or transplant. These decisions are made on a case-by-case basis. We've seen patients with ejection fractions as low as 15% live 10 or even 15 years after LVAD or transplant. One study showed referred for transplant with EF 20% had better survival than expected, with 63% surviving 1 year on tailored therapy alone. What predicts survival? Achieving low pulmonary artery wedge pressure during therapy, a sign your heart isn't backed up with fluid. Studies show 83% survival at 1 year for patients who achieve this goal. Age matters, but it's not the only factor. Patients aged VACE survival, but many older patients still benefit. It's about overall health, not just age. Here's a hard truth. While heart transplant is the best treatment, many patients die waiting for a donor. LVADs are therefore a crucial bridge to transplant for thousands of patients every year. Beyond survival, we care about quality of life. Most LVAD patients report dramatic improvements. It's not just adding years to life, it's adding life to years. I won't sugarcoat it. LVADs carry risks. Bleeding, infection, stroke, and device thrombosis are real concerns. But modern devices like the HeartMate 3 have dramatically reduced these complications. Living with an LVAD isn't just physical, it's psychological too. Patients need to adapt to living with an external device, and depression and anxiety are common. Support systems are critical. Can you survive 80% heart failure? The answer is yes. With LVADs, transplants, thousands of patients with EF20 live and thriving today. If you or a loved one have advanced heart failure, here's your action plan. See a cardiologist immediately. Ask about an echocardiogram and BNP blood test. Ask about referral to an advanced heart failure center. 3 things to remember. 1. Advanced heart failure is treatable. 2. LVADs and transplants offer real hope. Early referral saves lives. Don't wait until it's too late. If this video gave you hope, share it with someone who needs to hear it. Comment below, what surprised you most? And subscribe for more life-saving information.